All right. Welcome, everybody, to this week's Think Business. Sitting here with Randy Denha. And Randy, no, obviously, disrespect to you, but my parents always told me never be the smartest person in the room. And today I can say, Dr. Eric, Makhni, I absolutely am not the smartest person in the room. And because I just want to give your background. Your Bachelor of Science was at MIT, a Harvard medical grad, Harvard Business Masters, and did your fellowship at Rush University. I mean, I think we can end the interview now. You know, that is.
They don't pick anybody back then.
Yeah. So, you know, so we appreciate, Randy and I appreciate you being on the show. You know, we started this a few months ago when COVID really hit and we were all in our homes. And really it was about the whole idea of just mindset and getting through these times right now. And so, you know, I'll kind of kick off the questions. I mean, you are, you know, and let me just say this too, because I didn't actually say this. You are the Director of Quality and Informatics at Orthopedic Service Line, Henry Ford Health Systems, basically a sports medicine orthopedic surgeon practicing at Henry Ford. You got a team of physicians. You and a team work with the Detroit Lions, amongst many baseball players and athletes. I mean, your resume, we could spend the whole 30 minutes on your resume. It's incredibly impressive. So I appreciate you being here. I'll kind of, Randy, any initial intro thoughts for?
Yeah, I'm just happy Eric was able to, you know, slice out 30 minutes to be with us today.
Yeah. So I'll kind of kick off a question because, you know, I'm a business coach, and in business, you know, it's always about forecasting and projecting and looking at your business. And from a medical standpoint, and there's so many things we want to talk to you about today, but how can someone be preventative today when they look at just kind of medically?
Yeah, and you're talking about with the whole COVID?
With COVID, right. Like how can someone really be preventative when it comes to taking care of themselves? And I mean, obviously we know we're all social distancing and things of that nature, but what are some really, you know, preventative things that we can all do?
You know, so when this all started, social distancing was the first thing that came out, 6 feet, 6 feet, 6 feet. But it wasn't until much later that the importance of masks was known. So I'll put it this way. My wife is an anesthesiologist at Henry Ford. She unfortunately has had to intubate probably 60 to 70 patients that had COVID over the last couple of months. So it's been a very harrowing ordeal. And doing these intubations, this is about the most high risk you can get. It's an aerosolizing procedure, very high risk for the anesthesiologist. And, you know, knock on wood, unfortunately, she's been okay. And we've been tested through different clinical studies. And it just shows you how important the protective gear is, because she has the protective gear. And, you know, there's no social distancing when you're doing a procedure on somebody. So I think the most important thing really is the mask use. I mean, I think that if you do nothing else besides wear a mask and everyone else wears masks, I think that's going to be probably the biggest bang for your buck. And then the other common sense things like touching your face, washing your hands. And then I think, you know, my thought is this: if you look at what's been going on and who's been hit hardest with COVID, it's the patients who are obese, have diabetes, underlying conditions. So for those of you who are kind of on the borderline with diabetes or weight, I know I've been trying to kind of get better in gear over the last few months. Those are the only modifiable things that you can really do, or at least some of the modifiable things you can do in the short term to try to eat right, keep your stress levels low, sleep well, because there's not much you can do otherwise, because you can't really change who you are in 2-3 months, but you can modify what you can. So I think take home point, be mindful. Don't go to, I mean, like going to a crowded bar is not going to be a good idea. The mask use is so important in addition with the social distancing, and then just try to be as healthy as you can be. And that's your best chance. And the other thing is, if you feel like you've gotten symptoms or you've been in contact with somebody, just be vigilant. Get an oxygen probe, those little finger oxygen probes that you can monitor. So if your O2 is going down, then you at least know you may have to act earlier. And then be in touch with your medical docs and just keep abreast of what's going on online with all the new recommendations.
Yeah, you can buy one of those on Amazon.
Yeah,
we actually bought one. Yeah.
So Eric, what are you seeing in terms of? I know, you know, I know there was a period of time when many of us were working from home, and you know, again, I know that many physicians as well, having represented many of them, weren't doing surgeries, especially specialists like yourself. What are you seeing in terms of the profession right now relative to the patient's reluctance to come into the hospitals and really do any elective surgeries? What is the mindset of the physician right now that are in those specialties?
So that's a great question. So for 6 weeks, from basically end of March till early April to mid-May, I did not do any surgery. Maybe one surgery that was an acute thing I had to do. And I'm a sports surgeon, so I'm mostly elective surgery. So a lot of us just stopped. And you can see in our productivity reports, April was basically nothing. All of my clinics turned into virtual care clinics and telemedicine. And what I found was I could actually take care of a lot of people virtually, and I would come in when I needed to. If it's a first post-op visit to get the stitches out, you kind of have to go in. We did a study, our group, with one of my colleagues, and we actually did a team of people actually called every patient who was backlogged from surgery. It was like thousands of patients. 80% of patients wanted to get their surgery done as soon as possible. So there were some that canceled, but I remember when we started calling patients that you're ready for surgery, they were elated because they've been dealing with these injuries or these issues for so long, and that now they can get them fixed. So I will say most people, surprisingly, were very ready to get back into surgery. The ones who were, older or diabetics or pre-existing conditions wanted to wait. So I think at the time COVID hit, I probably had 40 to 50 surgeries that were scheduled that we canceled. I'd say over 30 we've already done or almost done at this point. And the medical field, it's been hit hard. It's been, billions of dollars to support the practices. Now at Henry Ford, the unique thing is we're an integrated health system. So we do own our own insurance company, which is HAP, Health Alliance Plan. So it's softened the blow a little bit, but it's certainly been tens of millions of dollars, I don't know what the number is, but per month or something of lost revenue. And so thousands of employees furloughed or half furloughed, and it's been fairly devastating.
Eric, on that note, let me ask you this. With COVID now, how has it changed the medical profession moving forward?
Yeah,
because I would have to think that a lot of these, the leadership teams and medical teams are getting together and saying, okay, what is the plan B, the plan C, the future? Yeah. I know there's been a lot of talk about there's a lot of telehealth and concierge, and what does it look like?
Yeah. So listen, you guys are business guys. I went to business school as well. And, these things, these crises, these pandemics, this is where innovation comes, right? And the people who innovate are going to stay above the curve. So telehealth, we did see huge telehealth when it first happened. I do think patients in general still like the in-person visits. They like to be examined. It's much more convenient for physicians to have in-person visits because then you can have them come in clinic. You're not so worried about getting right on time to call them. So I don't know if telehealth will go up as high as it was before in the pandemic, but certainly it's more. We're adopting our clinics goes, after surgery, we say, okay, come in 6 weeks, 12 weeks, 24 weeks, 1 year. And a lot of that's dogmatic, not with a lot of good evidence. So now what I do, and that's in my quality and informatics role, I set up a platform at Henry Ford in our orthopedics department to collect outcome scores. So now if I have a patient that hit their outcome milestone after a rotator cuff repair, and if it was earlier than scheduled, I just tell them, look, you don't have to come back in. Just do a telemedicine visit with me in a couple months, see how you're doing. And if there's any issues, come on in. So I'm much quicker to do the telemedicine. And before COVID hit, there was a lot of red tape getting telemedicine in the institution and also with regulations. When they got rid of all the regulations overnight, we all got telemedicine ready to go. So it was a necessity, and that was, again, more innovation because we're using it. We do it on our phones, so I could do telemedicine literally wherever I am. Yeah. I was having a kid's doctor visit, and someone wanted to see me at a certain time. I said, sure, and I stepped out and did the visit right then and there. So it's really, really nice. And I think going forwards, from a surgical perspective, and I'm sorry if you hear any background, I'm in the clinic break room, but from a surgical
mark in any second.
I was wondering who that was. Look at joint replacement surgery, right? There's traditionally done in the hospital setting. It doesn't need to be done in the hospital setting. It can be done in the ambulatory surgery center, and those are a little bit less traffic, less risk areas in some ways. So it's going to push us to match the level of care to the least acute setting, which is what we should be doing anyway, but it's just accelerating that process.
So Eric, you mentioned you went to business school, and obviously your credentials are very different than the typical doctor who gets an undergraduate degree and then their MD or DO. But you managed to, in addition to your bachelor's and medical degree, also receive an MBA. So I want to talk about the business of medicine. Do you believe that, well, let me say it differently. Does your MD make you a better MBA, or does your MBA make you a better MD? And I realize they're clearly divided roles, but there's going to be crossover because, as I was telling to Jonathan earlier before we chatted together, our income supports our lifestyles, but what we do with it creates our net worth. So I'd be curious to get your input on that.
I think what I say too, for the record, before you answer, that could be a book and a blog.
Yeah.
The question, right, and the answer. I just want to put that out there.
The biggest question I get is why the MBA, and it's kind of crazy. My brother and sister are all docs. My brother's a spine surgeon at Brigham at Harvard. My sister just finished residency at University of Michigan in medicine. She's doing informatics at University of Chicago. All three of us have our MBAs. And the reason was our parents were doctors, and they had a lot of trouble. They were a small private practice, two people. They were, born and raised in India, and they had a lot of trouble with the business aspect of medicine. And in a small private practice, you're very exposed to those issues. I'm not as exposed from the business aspect as I'm in a big system, but the business degree and that business mindset, and by no means you need an MBA for this, but you have a lens which you view your career from that helps you, chart your progress down the road. So from a medical perspective, building a practice, the importance of marketing, the importance of online reviews, the importance of having a niche where I can excel in makes it easier for me to grow a practice well, rather than if I came in and with a very myopic view of, okay, let's just get to the next day. So, and then in business school, we do learn about leadership, but I'll tell you, you don't really learn it that much. And you don't know what leadership you need to know when you're a business school student. So, my mentors who have been very successful have taught me the importance of studying leadership. So I will tell you what I read right now on my Audible is books about Lincoln and how he led, and Theodore Roosevelt and FDR, and about organizational behavior and emotional intelligence. That's what determines your success, much more than any letters after your name. And I think in medicine, and I can't speak to the business world because I'm not living in a corporate, finance environment or a corporate environment. But I'll tell you, throughout my training, I've seen so many surgeons lose their cool, get angry, get flustered, yell at staff. And what happens is they lose at the end of the day because staff doesn't feel as comfortable. They don't go to them if there's a mistake they see. And that's like leadership, interpersonal skills 101. And I don't think it's just something with surgeons. I know in the business world, it's the same thing. There's issues with leaders, and you see them in the headlines all the time. This manager did this for harassment. But it blows my mind how so many of these docs who I've worked with over the years, don't understand that just being nice really gets you what you want, right? If you have staff that appreciates you, and you show your appreciation, your productivity is much higher. So I try to make a point. If I'm running late, I will, make sure I apologize to the staff, and I try to, take care of any sort of things like lunch or even bonuses, whatever I can do to help, because that staff, at the end of the day, I'm benefiting from my staff. My staff gets paid, they're hourly, right? A lot of the support staff is hourly, yet I'm the one who gets paid or gets more improvement from a productivity perspective. So we're dependent on our staff. And I think, you don't learn it in business school as much, but as you progress, the leadership is what makes you successful.
Yeah.
And I'm new in my career, relatively new, so it's still evolving, but it seems to be the most important thing.
I love what you're talking about. There's a movie with William Hurt that was probably 20 some years old. It's called The Doctor, and he's just a jerk of a doctor. And it isn't until he gets sick and becomes a patient that he becomes more and evolves into what you're talking about, really, doctoring from a kind heart. And so I love what you're talking about. But I also I want to kind of expand on what you just talked about, which is, really maintaining a strong internal brand with your people, with your patients, with your team. But also externally, I want to talk about your external brand and where that is moving for doctors in general, because we have millennials, and we have older generations, but we have millennials and we have Gen Zs that are really looking for rich content from all walks of life and all businesses. And I'm a big believer that in years to come, people are going to be referred a doctor, a this, a that, a this, and that, and then they're going to go and see what their online platform is, and they're going to expect videos and blogs to be educated with really rich content. And so can you talk about, because I know there's compliance issues and everything with doctors as well, but what does the future brand of a doctor look like with the technology that we have at our hands?
You know, when I was in fellowship at Rush, we worked with 8 or 9 surgeons, and a year later, all of them had Instagram accounts, and they had websites, but now they're on Instagram, and they're answering questions, right? And they're posting their surgery, posting patient profiles, and there are compliance issues, and there's a different appetite for posting when you're a big system versus a private practice. But it really comes down to your web presence and your availability. It's so important. And it doesn't mean that I need to be on call 24/7, right? But it does mean that if a patient calls in on a Wednesday and they want to be heard or seen or something, get in with my PA, get in with one of my partners, just know that we are available. And I think that's where Henry Ford excels, because we have such a rich network of providers. Our sports teams all universally say, you know, the customer service is so good because we have an issue, someone's answering, someone's calling and calling back. And so docs, especially if you're an elective surgeon, people are going to, it's a sales job. It really is, because your skill to patients is relatively commoditized, because unless they have a personal experience or they see you do surgery, they're not going to be able to tell, is your rotator cuff repair better than the guys down the street, or your ACL reconstruction. But they know you based on how comfortable they are with you, how open your communication is, referrals, right? Most of the patients I see now are patients, the new ones are coming because they have a friend who saw me, or a colleague, or they heard about me. It's word of mouth, right? Just like any business. So if I present myself poorly, then I'm in trouble. And it doesn't matter what training I have, what skills, or if I'm rude, it doesn't matter. And so it becomes, patients want to feel comfortable with their doctors. If you're going to do surgery on them, they want to be comfortable. And before COVID hit, I was actually wearing suits and tie, and we talk about this every day in clinic. Now I'm wearing a polo because I don't want to be dragging germs everywhere. You know, it's all about professionalism, and to your point, the web presence matters. If you're going to have a surgery with somebody or see a doctor, you're probably be more comfortable if you can go to the website, see their staff, look at their office hours, look at videos, testimonials, rather than just a blank listing and a picture and a profile. So I think it matters a lot. And I think that just like e-commerce is more important than it was 10 years ago, it's the same thing in hospital systems. It's hard because we're not at the forefront of innovation, because there's a lot of red tape, a lot of HIPAA, a lot of patient compliance, a lot of these regulations that make big institutions nervous to dive headfirst into a, you know, because if you're going to go to dinner, you're going to book a table at Open Table or wherever. You can't do that with us yet. And there's many reasons for that, but there's going to be a point where you're going to direct schedule. And we're experimenting with that at Henry Ford now. And so it's getting there.
Yeah, great.
Yeah, so the future, you know, again, the business of medicine, I think, can morph, you know, many different ways. And I'm just curious, you know, obviously you don't have to, you know, share all the ingredients, but where do you think the future of medicine is? I mean, outside of, you know, our personal goodwill as professionals, you know, where is the future of medicine? Now, obviously we have telemedicine, you know, electronic medical records have come a long way.
Yeah.
There has to be something different.
I'll tell you, yeah. So in my role with patient-reported outcomes, it's all about measuring outcomes and responding to the patient. So we at Ford in our orthopedic department are probably among the leading providers, but we're actually measuring outcomes. And the way this comes into play is this: if you have an injury that's not life or death or not something structural and it's elective, right? How do we know that you actually need a surgery or that you won't get better from just physical therapy, right, or an injection? And as surgeons, we're in a unique situation where we create our own demand. If I say you need surgery, you're probably going to say, okay, right? But the reality is that if you're incentivized, if we're getting paid to do surgeries, a fee for service, we have an incentive to operate, right? That's how it is. I personally think the more non-operative and conservative you are, the bigger your practice becomes, because patients appreciate that you're looking out for them as a family member. I think that's how you grow your practice, to be honest. And I've learned that from so far in my experience. But where the business of medicine is going to change is that there's going to be more risk sharing with the providers. So we're going to get to a point soon where the insurance company is going to say, okay, this is your patient with knee arthritis. Here's a check. You do what you want to with it, right? But this is what you're going to be paid with to take care of this patient. So if you want to do unproven technologies that are very expensive, that don't help patients, go be my guest. You're going to eat that cost, right? And we're getting there. And there's surgical bundles. So when you have a hip replacement, many places, they get paid one amount. So if you want to spend 50 physical therapy visits after surgery or do 2 physical therapy visits and do a home program afterwards, one's obviously cheaper than the other, and you will net the profit or lose out on the extra cost. So the risk sharing is going to get more and more to providers, whereas back when Medicare was started, it was basically fee for service, and whatever you charged, you got. And those days are way over because there's a lot of stuff that you can get better with minimal treatment. And sometimes people get surgery because that's what, we want to do. We want to do stuff.
So it's almost a filtering system where, I mean, in terms of, weeding out those physicians that may, without, necessarily understanding the outcomes, and purely driven by profit, are effectively going to get weeded out of the space.
I think it will. And I think that, we're an academic. Henry Ford's a big academic center. We have a natural check rate. So if I do a surgery that's unindicated, you better believe my resident's going to question me. My student's going to question me. I'll get a call from my boss saying, what are you doing? Why'd you do that surgery? So we're very by the book, but there's a lot of places, and this is the reality of it, is that if you don't have those check rates, if you don't have those stops in place, there's no real regulation. There's no oversight. The government can't look at every single surgery and go through every chart. And so we've got to learn a way to hold folks accountable, do good work. And by and large, look, most surgeons are doing the right thing. There's no question. But sometimes the situations are also tricky, right? And so you need to have a good metric, a good incentive system financially, a good outcome system. We should be measuring outcomes on our patients and saying, okay, did we make you better or did we make you worse? Or we can look at it as an aggregate scale. And I think that risk sharing is, and at Ford, over half of our internal medicine patients in some populations are in these risk sharing contracts, these accountable care organizations. So we are responsible for their care and we are paid a certain amount. And so it's up to us to do the best driven, highest efficacy, lowest cost treatments that are the highest value. And value is outcomes over cost, right? So minimizing costs, maximizing outcomes improves value. And that's where things are changing. We're going to be more held responsible to our outcomes.
Yeah. I have a question for you, Eric, based on something you said earlier when we kicked things off about being preventative for COVID. And you mentioned, like I've heard many other doctors, and as I watch the news, that, underlying conditions, diabetes and obesity are the hardest hit groups. And if you take obesity and you take diabetes, and let's just throw in cigarette smoking, we're looking at over about 1 million deaths per year, according to Google, right, stats, right? And so when you're talking about responsibility for a patient's care, I don't think it's just the doctors, it's many organizations, it's, all of that. But what type of education needs to happen? Because, in business, it's kind of like you look at things and say, well, you control what you can control. Well, when it comes to certain things that you can control, like cigarette smoking, like educating yourself on healthier lifestyles, where does the education begin to make it, and how does it begin to make a difference?
I'll say the patient I operate least on, if ever, which is really never, are overweight patients with arthritis. But they're the ones who take most of my time in clinic because it's education and counseling. And it's not their fault, but a lot of patients who are overweight and who have arthritis don't know what the link is between the two. So talking about taking your health in your own matters, they don't realize that, there's some new research that came out that said weight loss is 95% diet, 5% exercise. So a patient comes in with knee pain and arthritis. They say, Doc, I can't move. I can't walk. I can't do exercise. And they don't understand that it's like going to a math and English test, which is 95% math and 5% English, and spending your time studying English, right? They don't understand. And again, it's not their fault. It's not because they're lazy. It's because they don't know. And then the other thing is it's all about behavior, right? So weight loss, there's a great book called The Obesity Code. Weight loss is set by hormonal regulation, right? And so if you're eating, you can eat the right things, but at the wrong times, and you'll gain weight, right? And you can try all these things to get better, but it's all about education, taking matters in your own hand, and then understanding why things like physical therapy or home exercises or weight loss actually help. And so when I will spend 25 minutes on a 10-minute visit with patients about weight loss, and I'll lose track of time because we're actually really engaged. And the light bulbs will go off and say, okay, maybe this is the right way to do things. And the other thing is about habits too. If you're trying to quit smoking, then you probably shouldn't have cigarettes lying around, right? That kind of thing. And we don't teach that enough either.
Right. I agree.
Yeah, and I think it comes down to, there's accountability also for the patient. We can't necessarily blame the patient or the consumer, but at some point there has to be a sharing of blame there also. And, WebMD, I think, is something that obviously frustrates many physicians, because people or patients come in and they're effectively self-diagnosing. They simply want you to confirm their findings, however much in error they are. And then you have shows like The Docs, right? So I think people have a natural appetite to learn more about health and wellness. And, in my mind, in terms of the business of medicine, I keep going back to this, that's where I see the future.
Yeah.
But finding the platform, recognized by the public as being the mainstream platform to get them to the finish line in terms of whatever challenges they might have.
And the risk sharing is going to go to the patient as well. We've seen this. We've heard of this, right? The insurance plans in different countries that reward you for being healthy. HAP, right? Every year we have our enrollment. We get a discount of a set amount of money if we do our screening and report our weights and get our labs drawn. So the risk sharing is where you get the best bang for your buck, because it's incentivizing everyone, right? That's the biggest thing I learned in business school is incentives. You align incentives, you get results, right? So if you do that, you're going to win. Right? And I think that's where this is going to keep going and getting more accountability with the patient and provider.
Eric, I could talk to you for hours. I would be one of those patients that would occupy a lot of your time talking to you, because you're easy to talk to, and it's really a pleasure talking to a doctor with your type of education and kindness, and with no ego that I could see. And Randy speaks so highly of you. So I can't thank you enough for taking time and talking with Randy and I. I'm going to ask one last question and then give it up to Randy to close it today. But my last question is this: one piece of wisdom, one sentence, a piece of advice that you would give someone who's listening right now, who, to use your words, is trying to get back into alignment.
I think that the most important things for success and career success is it comes down to grit and perseverance. And I think that's the biggest thing. And there's a great book called The Obstacle is the Way. Anything bad that happens to you is just your path to getting back to where you want to. So I've read that book probably 3 times.
So Brian Holiday, right?
Yep. Every time something bad happens, I'm like, wait, this is what's supposed to happen. So I think if you espouse that, then I think there's really nothing to stop you.
Great. I love that. That's great. I agree. Grit is key. Randy, Eric, thank you so much. I appreciate it.
Thank you for having me.
You're the smartest person I've ever talked to or met. Randy, take it home.
Thank you, Eric. I mean, obviously, Eric's, is something that I saw a long time ago. Your humility, your compassion, the empathy, it exudes. This is simply the fabric of who you are. And I think anyone watching that has any need for your services would be, doing themselves a huge favor. They and their families coming to see you. As a human, outstanding. I mean, you're as good as it gets. You're right up there in terms of, the type of people we want to be with and associate with. So thank you.
I appreciate that. Very kind words. Thank you guys for having me. And Randy, I look forward to our continued meetings in the neighborhood.
Eric, real quickly, tell people how they can get a hold of you if they want to reach out.
If you just Google my name, I've got a website. You can send a message in, or if you go to the Henry Ford website or just Google my name, you'll get to Henry Ford. There's ways to kind of make appointments or shoot me a message on the website, and I'm happy to respond to anything.
I love it. Well, hey, thank you very much, and all the best to you and your family, the growth of your business, and thank you so much.
Take care, guys. Thanks again for having me.
Thank you, Eric. Thank you, John.
Have a good one.
Thanks, guys. Bye. Eric.